Hello. Hi. Welcome to the show, To the Point, hosted by the American Acupuncture Council. And want to give a big thanks to them for creating these free shows for practitioners. Today, my subject is contraindications for facial rejuvenation acupuncture. The contraindications for facial rejuvenation acupuncture are different than regular acupuncture, and so they're definitely worth mentioning. Of course, you're going to keep your regular guidelines and contraindications that you use with regular acupuncture, but consider that you're bringing a lot of qi out to the surface and also yang to the head. You want to think of this, and then you will know kind of what conditions would be amenable or contraindicated. Can't list everything because there's so many diseases out there, but I am going to list the main ones, and I think you'll get the idea. So let's go to the slides. The contraindications of facial rejuvenation acupuncture would include problems with bleeding and bruising. So with bleeding, I'm talking about a hemophiliac. Now, if somebody is taking blood thinners, it will make them more prone to bleeding and bruising. It's not an absolute contraindication, and there has been research that shows acupuncture is permissible with blood thinners. But think about anything they might be taking that might cause them to bleed more, such as aspirin. So if somebody is taking aspirin preventatively, I would say if it's through their doctor, then maybe you could talk to the doctor and see if there's a way they might not have to take it during the course of the treatment series for a few months, or if it's self-prescribed, as it often is, then maybe you can get them to stop. And there are herbal alternatives for blood thinners. We're not going to talk about them here, but if somebody is taking blood thinners, something or even herbal things like garlic, fatty fish oils, these, and vitamin E, they're going to make people bruise a little bit more and a little bit more bleeding. So good things. Same with vitamin K, nattokinase, if you know that Japanese product for thinning the blood. So not an absolute contraindication, just you'd want to be more careful about it. So consider what kind of medications they're on. If they're on something like Plavix, that sensitizes a person to aspirin and tends to make them bleed and bruise more. So if somebody's a lot older or they have a very compromised spleen in the Chinese sense, they're going to bruise more easily. So I want to talk about bruising, as a whole nother topic in a future show. But if somebody has the tendency to bruise easily, this is not for treating an acute bruise, but for that tendency, what you can give them is grapeseed extract, not grapefruit, grapeseed extract. You know how they say wine is good for you? And I always think, who funded that study? Well, wine is made from the whole grape, including the seed. And the seed is like the jing of the plant. It's full of antioxidants. And grapeseed extract has many health benefits, but what I'm referring to here is its ability to build up collagen on the blood vessel walls, to give it the tone so that somebody doesn't bruise overly easily, as some people are wont to do. So that's something they can take for 3 months. The contraindication on it, though, would be if somebody is taking blood calcium channel blockers for high blood pressure, but that we're not treating people with this kind of acupuncture with high blood pressure. But otherwise, it's very safe, benign. You can take over time. You can take a higher dosage for, say, 3 months to build it up, because it takes about a month to build up. So it's good to start, say, a month before you start your treatment series, if possible. And then you could do a maintenance dosage long-term to keep that blood vessel on the tone, and then they're going to have less vascular issues over the long term. Now, pituitary tumors, I'm not talking about a general endocrine imbalance, but something that, if it was stimulated, might metastasize or move or exacerbate some symptoms. Now, high blood pressure, migraines, diabetes, these are all contraindications for facial rejuvenation acupuncture, not for regular acupuncture. You can treat those, and I recommend people do. But if we're bringing yang to the head, it's not a good idea, and it can be an intense treatment, but very effective, of course. With migraines, right? There's often, issues of liver fire and yang rising. Diabetes, it could be stomach fire, and there's also capillary fragility. And an intense treatment could alter insulin levels very quickly. So these are all things that they should be resolved first and distant history before you start doing the facial rejuvenation acupuncture series on them. They can all be treated with regular acupuncture, but sometimes people think, oh, I'm on medication for that, so what does it matter? Well, if you're on medication and you're not having extreme, side effects from the medication, then you still have that energetic tendency, and therefore you don't want to be doing this kind of treatment until you've cleared that. And it's doable, so why not? So really, and think of any serious health conditions. So this could be things like cancer, current cancer. People need all their resources to heal from this. Same with AIDS and HIV. They're going to be very livery with that, and so you wouldn't want that as a terrain to work with. Same with acute hepatitis and coronary disease. And of course, if you were doing, I don't do this, but if you were doing electroacupuncture on the face, you would not want somebody to be using a pacemaker. So I would say avoid irritated, ulcerated, or bruised areas and warts and pigmented moles. Now, you could treat maybe on the other side, contralaterally. You could treat somewhere else along the meridian to affect them, but there's just too many problems if you go directly into them. And if somebody has seizures and epilepsy, they're not a good candidate for this kind of treatment. If they have dizziness or tinnitus, tinnitus, depending on what country you're from, how you might pronounce this. But if it's a deficiency type, it might be okay. But if it's an excess type, a strong dizziness or tinnitus, it's not good. So I would say you don't want to do it during pregnancy. There's a lot of forbidden points that we use that would be forbidden in pregnancy. And also different intention. You want to consolidate things for the fetus as opposed to bringing things out to the surface and up. If somebody has a flu or cold, it's not the time to do it. We're using a lot of tonifying points, which you don't use strategically when somebody has a flu or cold. You want to more be releasing the surface. So if it's, they've had the cold for 10 days and they just have a little bit of residual mucus, but they don't have any cough and they're not, it's not pouring out of their nose anymore, then it's okay. But if somebody has an acute herpes outbreak, it's not the time to do it. And this could be especially oral herpes, but it could be genital. And also consider if they have herpes zoster. That could be an issue too. Now, acute allergic reactions, by this I mean it could be a seasonal allergy, like we were talking about flus and colds. Not the time to do it. There's a real histamine reaction that occurs, inflammation, and there's already probably some discharge from the nose, which would be encouraged, and that would, even though maybe acupuncture would help get all that extra phlegm out, it might be uncomfortable for people to do it so quickly. Now, if it's a dermal allergy, say you had a little rash on your arm, that's probably fine, a little chronic rash or mild rash. But if it's whole body or if it's on the face, I would say it's not the time to do it. Same with sunburn. Whole body sunburn or sunburn on the face, that's not when you want to be doing this kind of treatment. So cautions for doing it, not absolute contraindications. One would be former cosmetic surgery. And this is more from a liability standpoint than it is from, that it would be dangerous, because often people have side effects from the surgery. They have numbness maybe where they were cut. Maybe they have tingling. There's scar tissue to deal with. And acupuncture can really help with all those things. But what I would recommend is, because people sometimes forget what they had when and which came first and all this, get them to write in their own handwriting. I had a facelift 1 year ago. Since that time, I have pain, numbness, tingling, whatever they have, where and when they think it started. And because, a year or two from then, they might be all confused about what they did first and what caused what. And, the surgeon may not want to take credit for it. But if you have that, you can often help people with those side effects from surgery, and you can certainly give them the glow that they didn't get with just tightening through cosmetic surgery. So allopathic cosmetic procedures, we're talking like Botox and fillers and microdermabrasion and these. I'm going to talk about that in the future sometime because it's a really big issue. So many people want to be using this kind of, doing facial rejuvenation acupuncture concurrently while they're doing something like Botox. And there's no incidences of problems for this, but we want to make sure it stays that way, because otherwise it would be front page news, even if it was alleged that acupuncture had caused anything. If someone is asthmatic, that also is not a great candidate for it. You'd want to make sure that that's kind of under control more before you did this kind of treatment. And lymphedema, specifically, or especially on the face, it could be an issue, even though, acupuncture is great for lymphedema. I mean, it's just almost miraculous for lymphedema. But, people are more prone to infection. So you'd have to be super careful about this. And speaking of that, because we're doing a lot of needles on the face as well as the body, there are possibilities of people having a dermal reaction. Maybe if you're using cheap needles with nickel, people have allergies to certain needles. Some people can't tolerate silver and they have a reaction. So please try to just, be extra careful on the face because it would be visible. And then also it's a matter of, if people bruise a lot, or if they have a reaction, it's not good advertising for you, even if the patient doesn't mind and even if it's very temporary. So I would say that just exercise a little bit more caution than usual. And I think that that's pretty much what I want to say about that for this time. And another time we'll go into bruising and things like Botox and fillers, because it's very important. But I want to, again, thank you all for tuning in. Please spread the word. And next week, our host will be Lauren Brown. So he's always got something new going on. All right. Take care. Ciao.